Hi guys, and welcome back to Masala Chai. This is Sonal Patel. I'm a pediatrician and mom of four, and with me is the ever awesome Nithya.
Hey guys, I'm Nithya Natarajan, and I am a family medicine physician and mom of three boys. And today we are going to be talking about the different kinds of people that we encounter in our practices, and kind of how they approach, parenthood and taking care of a baby. So Sonal, if you want to start.
Yeah. Um, so so I think we were talking before when we started this that, being physicians, there's definitely a science that we learn. Science does not fool us, science evolves. We are supposed to be looking for the answers. However, on the same token, if you actually in your career are looking up to particular physicians who have been doing this for a very long time, or even bedside nurses. I mean, I've had bedside nurses who have doing their careers for 30 plus years. There's definitely also an art of medicine. And sometimes when we are evolving, sometimes we physicians ourselves are battling both things, right? Like we go into a room and we know exactly what to do on paper. But we're also trained to go into a room I remember going in, like I was told if I have to go to an ER, I need to know who to triage. And that is based on, like, that's what you learn, that you keep learning over and over again. And at some point, your foundation is the science of medicine. And then on top of that becomes the art of medicine.
Mm-hmm.
So when we're talking about the clients that we encounter, I have realized physicians, engineers, people that are so math driven, just very logistic, like everything has to be in a box and everything they need to know how many mLs per feed, or they have to have that app to tell me exactly how many diapers and stools. And honestly, like if you tell me I've been changing a diaper every day, every time I feed my child, I'm like, okay, good. I don't need to know a number because I knew enough that because usually that baby's feeding 8 to 10 times a day. And so those kind of people, like those kind of very, like, I need everything checked off in a box, fourth trimester is very hard for them. Don't you think? Because it's, first of all, it's a baby that is changing. Their sleep is changing. They're growing. Their guts are developing. And you could have one day that is like blissful and one day when your baby's up all the time eating. And it throws people off when that happens.
I
totally find that very amusing.
Yeah. And I totally agree with everything you say. And I think, I think physicians are a very interesting group. Engineers, like all of those people that are very focused on numbers and things are very interesting in this fourth trimester period, because babies don't care, right? Babies don't care how many minutes it's been. They don't care. All they know is that they want milk or they want you, right? It's not always about milk. Sometimes they just want their parent that they've been inside of for 9 months to hold them. And so, I think it's really hard. And, I think it's also especially hard if you just finish training, right? Because a lot of times that's when you're most entrenched in the science of medicine, and then you're still learning about the art of medicine. So we had our first baby right at the end of my fellowship. And so I had just come out of training. And I remember asking my mom, I was like, why is he eating again? Why is he eating again? It hasn't been 2 to 3 hours. It's only been 30 minutes. And she's like, I don't think the baby cares how long it's been. He just knows he's hungry, and that's why he's eating again. And I think that was, one of the lessons I had to learn as a parent, is that the baby doesn't care. And in medicine, we want everything to fit in a box. So in medicine, we try to teach people, all right, babies eat 15 minutes on each breast every 2 to 3 hours. When in reality, babies eat whenever they want for however long they want. And for the most part, you should just follow what they want. And I just remember I was like, why isn't he doing it right? Why isn't he? And what's wrong with my baby? And there was nothing wrong with my baby. There was something wrong in my attitude and how that fourth trimester works. And I think that's the most important thing, is to kind of throw all those expectations out the window, because you don't know who your baby is going to be. You don't know what they're going to be like. And they're an individual, they're a person. So they're going to, I think it's so hard because you just don't know what they will be. And a lot of the times it's easier if you just kind of go with the flow and kind of go with what they want to do. And I think that's the time that I see most first times moms have an easier time, is when they're more willing to go with what the baby wants
Yeah.
versus trying to fit everything into a perfect little box. And then the same thing like with second time moms and beyond, I think a part of the reason it's easier is because you've now learned that babies don't care. They don't care what your schedule is. They don't care when they're supposed to sleep or when they're supposed to eat. And I think by learning that, you've kind of now, you're able to be more responsive and able to enjoy that relationship more than you were if you're in a situation where you're like hyper focused on all the numbers.
No, I totally agree. I mean, when I encounter artists and painters and people in the music industry, that side of the brain, it's just like, oh yeah, I was up all night, but I think that's normal. You're like,
Right.
okay, you're thriving. You're just like, you're doing good. Yeah, I have no issues. Yeah, this is how it's supposed to be. You're like, yeah, you're actually right. And maybe I totally agree with you in the sense that like my first was like, I wanted to compartmentalize everything. I wanted to be like, okay, you're supposed to be eating every 3 hours. And why did daycare get rid of all my milk? And now
Right.
I'm struggling to produce more milk
Right.
and not realizing that, because there was so much more going on rather than just like, no, you're only supposed to be drinking 4 ounces. You're only supposed to be doing this. And it's just
Right.
like, yeah, we target physicians because we both are physicians and we're in that
Right.
world. But
Right.
engineers are, you can tell. It's funny, I asked the profession afterwards because I like try to guess it. And you can tell the engineers and the mathematicians and
Right.
the
Right.
scientists and people are in there. You're like, that's not how that works.
Right. Right. Yeah, because my sister is she's like a neuroscientist. She does neuroscience research, and she was the same way I was with her first baby. She was like, why are you eating more than you should be? Why are you doing this? Why are you doing that? And it's kind of like, that's just who she is. And then if there's an issue, certainly get that addressed. But most of the time, the baby is just being a baby and they kind of do what they want to. And I think that's kind of the basis of what we're trying to say in this is that sometimes it's easier to just kind of let it go and just follow your baby's cues and enjoy spending that time with them and just do what they want when they want in those early days. And then things will settle out. Eventually they will sleep longer. They will go longer between feeds. It doesn't go on forever. And those newborn days are numbered. So just enjoy that time.
And here's the deal. It's tiring as heck.
Yeah.
You're healing, things are leaking, you're in a diaper, your baby's in a diaper, you're changing your stuff and everything. I mean, let's not Hallmark it anymore.
Yeah.
Let's not Hollywood depict it. It is hard as hell.
Yeah.
Like, stop making it so blissful because first of all, let's kind of erase that. It's really hard. It's
Yeah.
hard on you. It's hard on career women's also because, and this is what I found, is that for that time being, my identity is I'm only a cow in that time being. And it's really hard to struggle with that identity. But like I said, after your second and your third, it's easier because you just realize it's just a short amount of time. And then I think that's why we both work on the fourth trimester is because we want people to realize it is 3 months at minimum.
Right.
There's research that says that sometimes it's over till a year, but at a minimum for 3 months, we need to give each other some grace. Like we as women need to give each other some grace in the choices that we're making. We as a society need to give women a little break in this time. I mean, the ramifications of allowing a woman to kind of transverse the first trimester is economical, and we don't have to get that into today, but it's proven science back and forth. But first of all, just us realizing it's hard. Like it is. It's hard. It's difficult. You're up all night. You're trying to sleep. When you have other kids on top of it, it's hard to balance. Mom guilt is real. It's all real. So just
it definitely is. And I think that adding that component of getting hyper focused on everything just makes it harder for everybody. And so really just giving yourself that grace as well and saying, you know what, this is hard and this is a lot, but it doesn't last forever, and do what you need to do to get through that period, right? So you do what works for you and your family, and don't worry about what everybody else thinks you should be doing. I think is kind of one of the things I always tell my families. It's like, do what is working for you, and you have people around you to support you. Hopefully, if you don't, let's find you some people to help support you, and figure out what really works for your family, because the same thing is not going to work for every family. And it is a very, very difficult period. It's going to be hard. And, I still remember somebody told me after my second baby, I came back to work and he was like, how did you enjoy your vacation? I was like, vacation? Are you kidding me? And I was like, did you enjoy your vacation while you were at boot camp last weekend? And I think that kind of shut him up because he never said anything about it again. But it's not vacation. Like your body has gone through a huge transformation, and now you're caring for another human being 24/7. And as you
And
said,
you might have other kids on top of that too.
Yeah, and you might,
and then you might have other kids. Yeah,
right. And I mean, it's a lot. It's a lot to recover from. And I think really like the key is finding what works for your family, and then kind of doing that and not worrying about all these other expectations of what you have to be doing. Right. It's really about what works for you and your baby.
But that's hard too, right? Expectations are, we place expectations on ourselves. Like, it's just like, if we don't breastfeed, we are a terrible mom. Or if we start breastfeeding and it only lasts for X amount of time, then we're a terrible mom. I did that to myself. Like, I beat myself over, and until I finally listened to myself and my body and my baby, that's when we were successful. But it's expectations that you put on it. And I think we kind of digressed a little, but I think me and you both are so passionate about the fact that we really need to start breaking down barriers about the fourth trimester. And it's not a vacation. You want a vacation? Go to Norway, man. They treat you so well there. And even then, the fourth trimester is not a vacation, but at least moms have a year off where they are able to, I always thought, like, at 4 months, I came out of this fog. Like, I would come out of this fog, I would feel like, and I could actually restart thinking. My babies were older. We started having a schedule. And that would have been awesome to have another 6 months to be like, okay, now that I've come out of this mental fog, how can I do this? But then you go back to work at 6 to 12 weeks here. Like, my maternity leave at most was only 3 months. So, but it's tough, guys. It's tough. But I guess what we're trying to say is, please, fourth trimester, it's hard. The newborn period is difficult. Sometimes I had a new client that she had her babies about 10 years apart. And one thing for you to realize also is, like, if you're 10 years apart, you had your first child at 25, where your body is so much different when you have your child at 35. It's not like you did something right or wrong at 25, but you're a different person then. Your body's different, versus 35. So do realize that you can't really be like, well, 10 years ago it was easy. Well, you were a different person 10 years ago. So, but please give yourself some grace.
Yeah, exactly.
Well, great. We'll see you guys next time. Please like, subscribe. You guys know the drill to help us grow. And if you have any topics that you'd like us to address, this is Masala Chai with Dr. Aunties. We do have older kids, so we definitely can talk about a gambit of stuff, though we are focused on the fourth trimester. So till next time, guys. Bye.
Bye.